Managing client care. The nursing team includes the nurse executive, which might be the vice president or the director of nursing, or both. They're concerned with maximizing quality of care while being cost effective and maintaining relationships and professional satisfaction of the staff. The nurse manager is in charge of day-to-day function of a unit or an area within the facility and includes staffing. The care delivery method should help a nurse achieve desirable outcomes for their clients through the way that work is organized. Different factors will contribute to the success of delivery of care, such as decision-making authority of nurses, autonomy, collaborative practice, and effective methods of communication with the healthcare team members. Some of the models of nursing care delivery are team nursing, in which there's an RN team leader who coordinates care for a group of clients. There's other RNs, LPNs, and CNAs within this team. Total patient care, where one nurse, one RN usually, will provide all nursing care for a caseload of clients, working with client families and healthcare members. Primary nursing, where one RN plans and directs care for a caseload of clients throughout their stay, focusing on the nurse-client relationship. In case management, we have a collaborative process of assessment, planning, facilitation, and advocacy for options and services that meet a client's needs through communication and available resources to promote quality, cost-effective outcomes. This is accomplished by one individual or group. Throughout the nursing program, you're going to learn the components necessary to be a leader. Make sure that you always utilize your resources, your instructors, other nurses, physicians, etc., and make sure that you use feedback constructively. It may sound like criticism, but it's always meant to point out areas that you can improve in. Develop your critical thinking skills. This will enable a nurse to provide a higher quality of care, and it allows a nurse to meet client needs while considering client preferences and alternative solutions to issues, understanding the reasons behind the interventions performed or considered, and evaluation of the interventions. Competence is the provision of care in a manner that is not harmful or potentially harmful to a client while following the guidelines for the performance of that care. How do we determine competence? Well, we can determine it in school by assessments such as tests and quizzes or skills checkoffs. But on the job, it's a routine checking of maintenance of skills and knowledge through in-services, assessments, and continuing education classes, demonstrations, etc. The nursing process is applied to make accurate clinical decisions. You have to identify the problem, develop a plan of care, implement nursing interventions, and always evaluate patient outcomes. If you make the wrong decision, you're going to have undesirable outcomes. Never hesitate to ask for help. Priorities are set by determining the client's needs. High priority, there's an immediate threat to survival or safety, whether it's physiological or psychological. Look at Maslow's hierarchy of needs. The basic needs are going to take priority. Intermediate priority is non-emergent and non-life-threatening. And low priority is an actual or potential problem that's not directly related to the client's illness or disease. Clients can have a combination of high, intermediate, and low priority needs all at the same time. And realize that priorities might change as client status changes. And FYI, always reassess the client that has a status change. Organizational skills. You start by determining priorities, and this begins during the change of shift report or patient report. You start determining what needs to be done, and you start prioritizing those needs. You begin making a mental plan, and you need to always be 1 or 2 steps ahead of the actual performance of the task. While you're doing one thing, you need to be thinking, what am I going to be doing next? Make sure that you have all of your appropriate equipment for your procedures before you go do the procedure. Delegate as necessary, and use your resources, especially other staff. Continuously evaluate the care provided to determine if outcomes are being met. Are any changes required? I recommend you keep a small notebook or some paper in your pocket to jot notes down on, such as times that medications were administered or dressing changes, time the doctor made rounds or a phone call was made or there was a client status change, etc. Ideally, nurses should document care provided as soon as it is provided, but unfortunately that's not always possible. So I encourage you not to think, I'll remember that, and not note the time event, as that's when something else is going to require your attention, such as a call light or a phone call or a code blue, etc. And then you're going to be struggling to remember what time what happened, or you forget an event and it does not get into your documentation. Skillful time management is a cost savings. It also helps the nurse provide optimal client care. It's preferable to complete one task before beginning another. But we know that women, not to put men down, are multitaskers. Nurses are, and that was proven in Mythbusters, by the way, nurses are often unable, due to time constraints, able to complete everything that needs to be done. We have to remember that client care is a team effort. What you don't complete should be completed by the next shift, but that doesn't mean that you should intentionally leave a task for the next shift. The next shift does have their own tasks that they have to complete. Team communication is vitally important, and there are several tools that are used in communication to staff and physicians. Some of those tools will help ensure that nothing important is omitted during communication, such as SBAR, which is Situation, Background, Assessment, and Recommendation. And you're going to be hearing a lot about that throughout your program. A Cardex. This will contain pertinent client information such as the name, age, physician, disease, tests and procedures, IV sites, vital sign frequency, how a client ambulates, do they have any equipment that's being used. This is most often used in shift change report. The person who delegates a task is ultimately responsible for the completion of the task, whether you're the one actually doing the task or not. You never delegate a task that you dislike doing because it will create negative feelings. For example, RNs and LPNs are just as capable of emptying a bedpan or walking a client as a CNA. You have to be familiar with the Nurse Practice Act to know what tasks can and cannot be delegated. You cannot delegate a task that is outside the scope of practice of an individual. Always remember the 5 rights of delegation. The right task, in other words, tasks to be delegated, tasks that can be delegated are repetitive, they require little supervision, they're relatively non-invasive, they have predictable results and potential minimal risk. With right circumstances, make sure that you use good clinical decision-making to determine the tasks to be delegated. The right person should be assigned the appropriate task on the right client. Communication must be clear and concise, and supervision has to be provided for appropriate monitoring and feedback. Again, you're never going to know all there is to know about nursing. Things are continually changing and evolving. You must continue to seek new knowledge. Even after you graduate, you will be learning something new every day.